my doctor's office. My name is Dr. Calliope. How are you doing today? Okay. I hope by the time you leave this examination, you feel even just the littlest bit better. So let me just grab my clipboard as well as my pen, and we will take a look at what we have planned for you. Let me see. Would you mind just confirming your name and date of birth? Very good. And is that your preferred name? And how do you like to be addressed? Excellent. Thank you. So, looks like we have a general examination for you. Is there any particular reason why you wanted this examination today? Very good. All right. So I'm going to ask you a few questions to complete your medical history and general information. Do you currently have any pain or any current illness at all? Right? And any changes to the medical history that we have on file? Excellent. And what about your family history? Any changes there? Perfect. And your allergies, is that list up to date? Anything to add? Good. And what about your medication list? Any changes to that? Okay. And what's the dosage? And how many times do you take that a day? Excellent. Thank you. Any other medications that need to be updated? Wonderful. Excellent. So for your general examination today, I'm going to start with getting your vital signs. This will include your temperature. It'll include your blood pressure, as well as your pulse and your respiration rate. After that, we are going to begin looking at you system by system. I generally start with the head, so we'll look at your eyes and do a few different tests there. We'll look at your nose, your mouth, your throat, your ears, as well as your lymph nodes. And I will also be listening to your heart, to your lungs. We may do a little percussion as well. And we'll move on to your abdomen. So we'll auscultate, palpate, and percuss the abdomen. And then we will focus on your extremities. You have any questions for me so far? Okay. Well, I'm going to take care to explain everything thoroughly for you so that you're not lost. All right? If you have any other questions, or if you feel any pain or discomfort, please let me know. All right? Wonderful. Thank you. I'm going to start with sanitizing my hands and donning a pair of gloves. with the aid of our sanitizer, clearing up any oils on the hands. These tend to go on a lot slicker. There. Easy does it. Now, let's start with your vital signs. Now, to start with, we are going to look at your temperature using this digital thermometer. I'm just going to be taking it out of its protective case. All of our tools have been sterilized prior to use, and they will be sterilized right after as well. Now I'm just going to press the button here, and I'm going to have you open your mouth. I'm going to have you lift your tongue to the roof of your mouth, and I'm going to place this probe right here, just at the bottom of your tongue at the base, and then we'll have you lay your tongue back down over it. So I'm going to turn this on. You can open your mouth, lift your tongue to the roof of your mouth. Good, and just lay your tongue back down on the probe. And here we're going to wait a few moments. It's a bit quicker than if we had a manual thermometer. Excellent. Now I'll have you close your mouth, and I'm going to place this back into our case. We have you at 98.1 degrees Fahrenheit. Now, to take your pulse and respiration rate, I'm just going to be having you lay out your arms. Do you have any preference as to which arm I use? Okay, then I'll use this one here. I'm going to be putting my first two fingers right below your thumb here. I'm going to be pressing them on the radial artery and feeling the pulse. I'm feeling the quality of the pulse as well as the number of beats that it has. Typically, we tend to sit here for about 15 seconds, and then we multiply that number by 4 to get your beats per minute value. While I am taking your pulse, right afterwards, I will be measuring your respirations. Same kind of deal, just going to be observing your breath, and after about 15 seconds, then I'm going to be multiplying that number to get our value. All right? Okay, so let me just place my two fingers on the radial artery here. Got a good strong pulse. It's very easy to measure. And we're just going to sit here for just a little bit. Excellent. We have 72 beats per minute, as well as 16 for your respiration rate. Excellent. Now we're going to take your blood pressure. I'm going to be taking your blood pressure with the sphygmomanometer. and the stethoscope. To free my hands and make sure that I'm not juggling things around too much, I'm going to put it in the stethoscope first. That way, I can just hang out with that for a minute. Now, the sphygmomanometer consists of a few different parts. We have the cuff, of course, and this is going to be going around your arm. And I'll just use this arm right here that we used for our pulse measuring. I have a little dial here, and this measures in millimeters of mercury what your blood pressure is. There are two values to a blood pressure reading. We have the systole value as well as your diastolic pressure. And then we have our bulb, and this is what we use to fill the cuff with air. Now, on the end of the bulb, we have a dial here, and this dial lets air out of the cuff. So when you hear that rush of air, that's this little guy being opened, and then that helps the cuff deflate. Just going to make sure that this is all the way closed, and then we're going to place the cuff on your arm. Excellent. I just want you to relax your arm, and the two tubes that come out of the cuff that connect to the bulb and the dial just run down along the radial artery. It's parallel. And I'm just going to be filling the cuff with air until I stop hearing the rush of blood into your arm. And that's why I use the stethoscope. Put this at the crook of your elbow. All right, ready? Okay. Just going to take the cuff off. I know it's not the most pleasant experience. And remove the stethoscope just for the moment. Very good. Let me just put that down, and we will get started with your head. So, have you had any problems with your head, your scalp, any injuries, any strange rashes, any points of itching or irritation? Nothing of the sort? All right. I'm just going to take a quick peek, real quick. And I'm just going to make sure. So I am just going to be using my thumbs here to comb through the hairline and part the hair so that I can see if there is any signs of, say, psoriasis or any sort of infestation, or sometimes certain rashes or even lesions can be found along the hairline. And then I'm just going to come to the side here so that I can look right by the ear and back. Good. And the other side, just looking for those skin conditions or any sign of injury or parasite. Okay, and now I'm just going to be palpating the head to make sure that the contours of the skull are as they should be. There isn't any gross deviation. Essentially, there are lumps and bumps where there should be, and no lumps and bumps where there should not be. I'm just going to be feeling all over the head. Any pain or tenderness when I do this? Good. Very good. Now I just want to have a look at your face, at the skin, and I won't be able to necessarily feel any fine textural differences while I have the gloves on, but I can look at the skin and some differences in texture can be seen should I look close enough. Or perhaps at a different angle. Now on the skin we look at signs of eczema, rosacea. We look at color changes in the skin. Is the skin much lighter than it's supposed to be? Is it much darker than it's supposed to be? Is it yellowed? Is it reddened? Is it blue? Looking for any injuries, any broken capillaries. Okay. And this right here. Is this recent? Okay, just nicked yourself. Right. Well, we'll keep an eye on that. Make sure that it heals correctly. Have you noticed any changes in the way any of your wounds heal? Or have you noticed wounds that pop up without you recalling where they came from? No? Okay. And healing rate seems to be fine? Good, good. Let's take a peek at your eyes then. So, your eyebrows are intact, which is good. If you lose the outer third of your eyebrow, that can signal a few different conditions, oddly enough. Good, and the eyelashes are healthy with an equal distribution. Good, and the sclera is bright, and the irises are clear. The pupils have been reacting appropriately as you focus in and out. Good, good. We'll check on that a little later as well. Now I'm going to look at your conjunctiva. So I'm going to pull down your eyelids and I want you to look upwards. Okay, pulling down and you look upwards, and I'm looking to make sure that the tissues are pink and moist. There isn't any redness or signs of infection. Good. And I'm going to have you look up, or I'm going to have you look down rather, and I'm going to pull up. I'm going to pull up, you look down. Good. And that just exaggerates the tissues a bit easier to see since we have the white background of your eye. Okay, so that looks good. You can take a few blinks if needed. I know the eyes can get a touch dry. Have you noticed that your eyes are more watery than usual or more dry than usual? Are you experiencing any strain, any pain, or irritation? Okay, everything seems to be good. All right, I'm going to grab a little pen light here, and I'm just going to take a look at your eyes with the light. Just doing a little bit of a second round of inspection. And just making sure that your eye is again reacting to the light. We want your pupils to be equal, be round, and reactive to light. Good. Let me look at the other side a bit. Just going to take a moment to jot down some notes. Excellent. Now we're going to be doing some more tests with the light. The first one is not very involved on your part at all. This is known as the swinging light test. I'm going to be bringing the light into one eye, and then we swing it to the other eye, and then we swing it back. As I'm doing this, I'm looking for a defect in the way your eyes react to the light. So I'll keep shining the light in one eye and then swing it back to the other. And just watching how your eyes react to the light. Good. Now we're going to do what's known as the direct consensual response test. In the direct consensual response test, I'm going to be holding up my hand right between your eyes so that it blocks any light coming through. I'm going to be lighting one eye with the pen light, and as I shine the light into this eye, your pupil will react to the light. That is our direct response, as it is directly reacting to the light. And if I watch the other eye, when I shine the light into this other eye, even though I'm not shining any light into it, should react the same way at the same time as the light, as the eye being shined into. That is our consensual response. So again, this won't take really any sort of action on your end, but I'm just going to be holding my hand up between your eyes, and I'm going to come in at a diagonal angle, and I'm just going to be shining the light in one eye to look for the direct response. Direct. Direct. and the consensual response. Consensual. Consensual. And now we switch sides. Now we'll come in at an oblique angle. Look at the direct response, as well as the consensual response. Excellent. Give me just a moment. I can jot this down. Very good. And now two fan favorites. We have the follow the light, or the H test, as well as the accommodation reflex. I'm going to sit back just a little bit so we have some room, and I'm going to shine the light right in front of you. I want you to keep your eyes focused on this light. I want you to keep focusing on it using only your eyes without moving your head. I want you to follow this light. Now, I'm going to be making an H shape. That's why it's also known as the H test. All you have to do is just follow the light using only your eyes without moving your head. Follow the light using only your eyes without moving your head. Wonderful. We are checking the cardinal directions of gaze. We're looking for a delay or any skipping in the way your eyes move. And now I'm going to look for something known as lid lag. So we're just going to keep following this light as I go up and down, up and down. Good. Let's go to the side, side, the side. And now we're going to look diagonally up. Just keep following the light using only your eyes without moving your head. We go diagonally down, diagonally down, diagonally up, diagonally up, diagonally down, diagonally down, diagonally up. Good. Now I want you to just real quick look at the wall behind me. Good. And now I'm going to have you look at the light. Keep looking at the light using only your eyes without moving your head. And we're going to test the accommodation reflex. So we go in and out. Just keep following the light. In, out, in, out. If you could look at the wall behind me. and then look at the light. Just keep following it as we go in and out, in and out, in and out. Good. Now you can blink your eyes, shake your head a little bit if you need to. Just take a moment while I write down some notes regarding the tests that we performed on the eyes. Good. And now I am going to be moving on to the ears. So for this, we're going to use a tool known as an otoscope. My otoscope has a base as well as the otoscope attachment. I also have an ophthalmoscope attachment, but we're going to be using this one. We're just going to screw in the base to the attachment. Good. And then we're going to pick a fresh, clean speculum. I have a little tube full of them. We're just going to pop one out. And then I'm just going to be taking our speculum and twisting it onto our otoscope. Now, I'm going to first take a look at the ears before we look inside the ears, all right? Okay, so I'm going to start with this ear right here, and we're just going to inspect the ear firstly. I'm looking for any signs of lesions, of redness, anything that may indicate an infection going on, any tenderness at all. No? Okay. And if I just pull back on the ear here, okay, and there's nothing back behind here that I need to be worried about, I think. Okay, and the other ear, just taking a good look at the tragus, at the helix, the lobe, all the little inner structures, as well as the entrance to the ear canal. Also, if we just fold the ear back over. Okay, I don't see any signs of any skin abnormalities here. Okay. Have you had any problems with your ears lately? Any hearing loss? Any feelings of fullness in the ears? Any sort of burning, pain, anything like that? No. Okay. I'm just going to be palpating around the ears real quick, all right? I'm going to be doing this bilaterally, so both at the same time, all right? You just let me know if any of this is painful at all. Just rolling the ear between my fingers, looking for any little lumps in the pinna. No pain, no tenderness. Okay, and what if I just pull up a little bit? No. And what if I pull down? No. And what about back? No. Okay. All right, so I think it's safe to proceed then. So I'm just going to be flipping the light on our otoscope so that I can see inside your ear canal. I'm going to be pulling the helix up and back, and this helps straighten out the ear canal. I'm going to be inserting the otoscope into the ear canal, and then I'm just going to be having a little look inside. I'm going to be looking at both the ear canal and at the tympanic membrane that separates the ear canal from all of your inner ear workings. I'm just going to start with this side. We're going to pull the ear up and back, and then I'm just going to be just gently pressing the otoscope into the ear. Okay, and I'm going to be looking into the external auditory medius for any signs of infection or impaction, any irritation, any swelling, as well as looking at the tympanic membrane, which is also known as your eardrum. And just going to be making sure the eardrum is a nice pearly gray color, as well as not having any perforation, and there's no bulging to it, that it's slightly translucent so I can see the reflection of my light bouncing off. I can see just a little bit of the tip of the malleus inside the ear. Okay, and let me just pull my otoscope out and let your ear go. Now I'm just going to be looking at the other side. I'm going to be pulling the ear up and back, and then taking a little look into the ear. So again, we start with the ear canal. We look at the hair distribution, the consistency of the cerumen in the ear, also known as earwax. And then we look a little deeper at the tympanic membrane, making sure there's no fluid in the ear, that we're not seeing any signs of infection. There's no perforation. There's no cuts or wounds of any sort. And we're making sure that we can see just behind the tympanic membrane, and making sure that it's the correct color, pearly gray color. Okay, I'm just going to take the otoscope out and put your ear back. Okay, how was that? Any pain or discomfort? No. Okay, very good. So, give me just a moment. Okay, now we're going to take a look at your nose, your mouth, and your throat. So for this, I'm going to grab a new speculum, because we don't want to have a speculum that was just in your ear go into your nose. So that there, and just pop on a fresh one here. And now we're going to be taking a look in the nose. So this is not exactly going to go in your nose. At most, it'll probably go right at the base of the nose. This way I can take a look at the tissues inside the nose, as well as the septum that divides the nostrils. If you could just tip your head back so that I could get a good look. Okay. There we go. And any problems with your sense of smell or any problems breathing with your nose? What about your sinuses? Okay. Oh. Looks like from both sides the septum is intact. Not seeing any signs of deviation. The nasal passages look pretty clear. And I'm not seeing any fluid at all. Any excess fluid, rather. Okay. So that looks pretty good. So let me take off that speculum. And now we can look at your mouth and your throat. Okay. So I'm not going to be coming inside your mouth with this one. It's just a little aid to help me see. You could just open your mouth for me real quick. Okay, I'm just going to take a look at the teeth first. Right? Not seeing any signs of cavities. There's no bleeding around the gums. Good pink color, not red or overly pale. Okay, can you lift your tongue to the roof of your mouth? Very good. So the base of your tongue looks healthy. The floor of your mouth looks good. Okay. So let me grab a tongue depressor. And I want you to lay your tongue back down, and then I'm just going to press it down with this tongue depressor here. Okay, and now we're going to take a look at your throat. Now I'm making sure that it doesn't look overly red. I'm not seeing any signs of infection, irritation, swelling, redness, as well as looking at the uvula, making sure it is midline. And if you could just say "ah" for me. Yep, there we go. Okay. Alright, I'm not seeing anything down by the tonsils. Okay, good. Go ahead and close your mouth for a moment. Have you had any problems with sore throats lately? No? And any troubles with your voice? Any hoarseness? Okay, and what about swallowing? Have you had any trouble with swallowing at all? Alright, now I'm going to take just a quick little look at your lips. Color looks correct for your skin tone. They're not overly pale or too dark. And can you open your mouth just a little? I want to look at the corners. Okay. All right, you can go ahead and close your mouth. Do you bite at your lips a lot? Nervous habit? I feel you there. I'm one of those as well. Well, otherwise, they look pretty good. Now I'm just going to real quick, we're going to check your sinuses. I'm going to tap along your sinuses, and you just let me know if it's painful or tender at all. We start right by the nose. I'm just going to press in, release, Press and release. Press and release. Okay. Press, release. Okay, and now I'm going to tap along them. Any pain? No? Okay. Any pain here? Okay, very good. So sinuses look good. All right. So give me just a moment and then we'll move on to your lymph nodes. Okay. So I'm just going to be feeling from the back of your head. We're going to go around the ears, under the jaw, down the neck, all the way to the top of the clavicle. All right. And I'm just going to be palpating, and especially under the jaw, I'm going to be rolling the skin to feel if there's any distension or any mobility in the lymph nodes. Okay. All right, so let's start at the occipital, right at the back of the head. These are generally at your hairline. Just feeling, palpating, rolling my fingers a little. Okay, and then we come right behind the ear here. And this is your post-auricular lymph nodes, right behind the ear. And then we come into the pre-auricular lymph nodes. And these are right in front of the ear, as the name would suggest. And then I'll check the parotid gland while I'm right here. This is just in front of and below the ears. Okay, and then let's come under the jaw here. Start in the back and work forward. We have the submandibular and submental lymph nodes here, and these take a little bit of rolling to feel. Okay, and now I'm going to work into the neck. So here we have superficial cervical. We have the deep cervical chain. We have posterior cervical. And if I needed to feel a little bit better, I would have you turn your head to the side, but I'm not feeling anything here. So we'll come down to supraclavicular, right above the clavicle. Feeling here. Okay, those feel good. Those feel good. So let's do some auscultation. So I'm just going to be taking a listen to your heart and lungs. I'm going to start with your heart, and I'm just going to have you breathe normally for me. So let's start with the aortic area right here. Good, just keep breathing normally. And then move to the pulmonic area of the heart. And to the tricuspid. And the mitral. just going to be listening to Herb's point right here. Good. And now let's listen to your lungs. So I'm going to be making a ladder type movement. So we'll listen to a portion near the top. We'll move to the other side. Go down on that side. Over, down, over, down, over. You get the gist of it. So when I put the stethoscope on your chest here, I want you to take a deep breath in for me. And out. Deep breath in for me. And out. And we'll move down. Take a deep breath in for me. And out. Moving to my left. Take a deep breath in. And out. Just listening for any crackling, any wheezing. Listening to how your lungs empty and expand. Take a deep breath in. And out. Deep breath in. And out. Okay. So for the moment, we're going to put this down. So now I'm going to be doing some percussion. And with percussion, I'm going to be putting my hand on your chest, and I'm going to be tapping on one of my fingers, and I'm listening for the sound that comes back. So I can tell whether an area is filled with fluid or not. When I use this on your abdomen, this helps me map the contours of your organs. So I'm just going to be placing my hand all around your chest, and I tend to move in the ladder movement that I have when we auscultate, and you're just going to hear just these taps, okay? I'm just going to put my hand on your chest here, and we're going to, okay? Good. Good, okay. That all sounded pretty good. Now we're going to bring the stethoscope back. And we're going to listen to your abdomen. We're going to listen first because if I start palpating or percussing on the abdomen, that's going to change the sounds. So I want you to just keep breathing normally for me. And I'm going to be listening to each of the quadrants. A little more specifically, I'm going to be listening across all 9 sections. Just keep breathing normally. Just listening to how your organs are moving. Okay, good. And let's do some palpation and some percussion. All right, so I'm going to palpate using two different types of pressure. The first one is going to be more gentle, and the second one is going to be quite a bit firmer, okay? So we're going to do more of a shallow palpation to start, and I like to use both hands on the stomach, but it's not going to be too much pressure, okay? And I just want you to keep breathing through it, okay? So I'm just going to be pushing in and feeling around the organs. Please let me know if there's any pain or tenderness, okay? Any pain or tenderness? No, maybe right there? Okay, a little bit. Okay. Right. And then let's go in with our deep pressure. So this one may be a little uncomfortable. Again, I want you to just breathe through it, and it doesn't last very long, okay? So, all right, I'm going to put quite a bit of pressure here. Yeah, that one's not a fun one, huh? All right, you can take a breath, that's all done. Okay, so with percussion, it's going to be a lot easier than that. So I'm going to do the same thing that I did with your chest. I'm going to be placing my hand on your abdomen, and I'm going to be tapping with my middle finger of my right hand onto my middle finger of my left hand, right on the joint there. And I'm just going to be tapping all around the abdomen, okay? All right, this will be a lot easier to breathe through. Sounds good. All right, now lastly, we're just about finished, which I think is probably a good thing because it's getting pretty noisy out there, huh? Yeah, it's been like this for days, but I think hopefully it should quiet down. We should be getting some rain soon. But we're gonna look at your extremities real quick, okay? If you had any problems with your joints at all, any muscle pain, no fatigue in the muscles that's not quite appropriate. Okay, you mind if I look at your hands? Good. Now, let me just press on the nails. We're going to look at the capillary refill. I'm going to press on the nail for about a second and release. And the color should come back within 2 seconds. I'm going to press it down until it's white. Take my finger off, and then it should return to pink real quick. Each finger and the pinky. Good. Okay. Can you splay your fingers for me? Good, and you can press them together. Can you turn your hands over for me? Okay, and I'm just going to look at the palms and the undersides of the fingers. Okay, coloring looks good. It doesn't look splotchy. Right, and now I'm just going to be feeling with the backs of my hands. I'm going to feel the temperature all up your arms, okay? Make sure that's all consistent. Okay, it feels nice and warm. And can you show me your elbows real quick? There's quite a few skin conditions that we can find here. Tends to be a pretty neglected area, one that we don't usually notice. Okay, that looks good. All right, let's take a look at your legs real quick. All right. You got a bruise right here. What's that from? Yeah, I always have all sorts of bruises, but that's because I'm constantly running into everything. I just don't really understand where my limbs are at a given moment. I know that, hey, maybe my right leg is right here, but where the hell's my left leg? That is until it smack it into a door or a chair or something. Okay, so the shins look good. I'm not seeing any swelling or inflammation, any skin changes. And let's take a look at the ankles, okay? I'm just gonna feel your pedal pulse here. Okay, and I'm not seeing any edema around the ankles either. And you don't have a problem with swelling in your feet or ankles, do you? Okay, very good. All right, so I think that's going to about do it then. So, did you have any questions at all? No? It's pretty well explained. Okay, so I'm just gonna sign off real quick. Very good. And I think that will do it. All right? Okay. Thank you so much for coming into my office for this general examination. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Goodbye now. Of course, the sound stops now.